To mark the 2025 World Lupus Day, a non-governmental organization, Lupus Warriors NG, holds a sensitization walk and free medical screening in Ibadan. The organization also provides about 100 lupus patients with free medications and cash donations. The founder, Lupus Warriors NG, and a lupus warrior herself, explains the significance of awareness and early diagnosis of the disease.
Every 10th of May, World Lupus Day is being celebrated. The month of May is dedicated to celebrating lupus. Lupus is an autoimmune disease when your immune system attacks your body. It attacks the healthy tissues in the body and it can affect any part of your body. So this month we are celebrating every lupus warrior, people living with lupus, and today especially we are creating awareness so that people can know more about the disease and also help to spread the word. Lupus is an autoimmune disease. I've been living with lupus for over 7 years. In December this year is going to be 8 years since I've been living with lupus. When I got my diagnosis, lupus also affected my sight. I was blind for over a year. As someone who is still partially sighted, I still can't see very well. It is very challenging living and navigating the world with my inabilities. But also, even with the medications, the hospital visits, it can be a lot. With lupus, you have very high days and you have very low days. The most important thing is I try to take my medications and stay positive. Finances can be very difficult, which is one of the reasons why we are giving out free medications today, because the medications are not cheap. How have I been able to manage? It has just been God. So which is why we are trying to do this awareness so that more people can support us, join us to help lupus patients live a full and meaningful life.
She appeals to government at all levels to increase awareness and work with hospitals nationwide to make lupus medication free.
Most lupus patients already have a disability because they have lupus. It's either it's affecting their legs, their eyes, their hands. We already have to deal with that, and some of us are not able to do our normal job. I can't do a 9 to 5 anymore because I cannot read on paper or read on laptop.
A consultant rheumatologist at University College Hospital explains the disease and its challenges.
The immune system of our human body, the cells there are highly trained to recognize the body cells so that they don't attack it and to identify foreign cells and destroy it. And they too are very toxic cells. When they are activated, they destroy whatever they come in contact with. So you now have some of them failing to recognize the body as self and just attacking it. When we talk about the population percentage of lupus, we're going to talk about the prevalence. It's around 0.5, okay? It varies, okay? Now it's commoner in females far than in males, between the ratio 8:1 to 9:1. Because the symptoms of lupus, when they are starting, they are easily mistaken for another disease. And the commonest disease that people think they are treating or they have is malaria or typhoid. But the pattern is that the person just noticed that this week they treat malaria, 2 weeks after they treat typhoid, malaria, they are always treating malaria that is not going and still coming back. So that should cause a red alert, okay? It should raise a red flag. If you are thinking you are treating something and the drug you are using is not working, that means you are not treating what you think you are treating. People make the error of saying, oh, it's resistant malaria. It might not be. So that's why we always advise you. Commonest symptoms of lupus: fatigue, joint pain, low-grade fever. Some will have rash. In fact, the people that have rash are a bit fortunate. Why? Because they notice that this is not just malaria and come on time. But those that don't have a rash, the lupus symptoms can simmer for months or even years before they are diagnosed. Okay? So this awareness day is to bring people to the awareness that there is a disease called lupus that starts off with simple symptoms, but it is very serious.
The consultant stresses the importance of early diagnosis to prevent irreversible organ damage, especially to the kidney.
The vital organs are those organs that you cannot do without. And that's why patients that have lupus disease that affects the kidney, and especially when they come late, when there's already irreversible damage, they will need renal transplant. So a lot of people that think that lupus is a death sentence, it is not. Now, one of the challenges of treatment of lupus is some of the side effects of the drug. The rheumatologist is trained to monitor this and prevent this as we treat. So when you are being treated by a non-specialist, the adverse drug events are higher, okay? Because there are standards that we use to monitor the care of our patients and to reduce those adverse reactions from those medications. On an average, we're talking about close to 100K per month, and that has occurred because of the fall in the naira to the dollar. Okay, has really caused an increase in the prices and all that. And another challenge we have also is the availability of those medications. By spreading the awareness, we are hoping that even pharmaceutical companies will begin to even bring it in, because a lot of people don't know about lupus. When they see those drugs, they say, oh, these are cancer drugs, we don't need it. No, we also use them at a lower, safer dose to control patients with autoimmune diseases like lupus. With this awareness, it's just to let the government know that there are citizens who have this condition, that have this need, okay? And if they can expedite the inclusion of these our drugs, our medications for lupus patients or other autoimmune disease into the essential drug list, it will do our patients a lot of good.
A lupus patient and beneficiary, Titilayo Adigun, shares her experience.
I was in JS3 where we just finished our exam, and I think in school I just started having a sharp pain. Then the pain started making me bleed. 2 weeks later, I started having running temperature. I could not eat. I was vomiting. I was swollen. I could not walk. Then they did a biopsy on me. Then that's when they knew that I had lupus. Very stressful, but it's normal. See, after some time, it becomes normal to you. After sometimes the drugs become like you're taking water. After sometimes it becomes like you're like everybody. But before, I could take around 20 to 30 drugs. It's just many pills though in a day, morning and night. But now it has reduced to maybe like 5, 10. 5 in the night, 10 in the morning.